In 2018, a team of surgeons at Johns Hopkins Hospital performed a surgery that had never been attempted before in the United States. For 14 hours they worked to give a wounded veteran something that most of us take for granted: the ability to feel whole again. This wasn't just a medical procedure, this was a restoration of dignity, function, and hope. This is the story of how cutting-edge medicine gave a hero a second chance at life. Welcome back to Mind and Marvel, where we explore the most remarkable medical breakthroughs that push the boundaries of what's possible. Today we're covering a story that represents the intersection of surgical innovation, military medicine, and the profound human cost of war. Modern warfare has created unprecedented challenges for military medicine. Improved body armor and battlefield medical care mean that soldiers are surviving injuries that would have been fatal in previous conflicts. But survival often comes with life-altering consequences that require revolutionary medical solutions. Genital and urogenital injuries affect approximately 20% of combat casualties in recent conflicts, with improvised explosive devices being the primary cause. These injuries don't just affect physical function, they impact identity, relationships, and psychological well-being in profound ways. In March 2018, a team led by Dr. W.P. Andrew Lee at Johns Hopkins Hospital performed the most complex genital transplant ever attempted in the United States. The recipient was a veteran who had suffered devastating injuries in Afghanistan, and the surgery would restore not just function, but hope. This wasn't just a medical procedure, it was a 14-hour marathon of microsurgery involving the transplantation of the penis, scrotum, and partial abdominal wall. The complexity was staggering, the stakes were enormous, and the implications for reconstructive medicine were revolutionary. So how do you perform the impossible? What does this breakthrough mean for wounded veterans? And how is this surgery changing the future of reconstructive medicine? Let's explore the science, the surgery, and the hope behind this medical miracle. To understand why this surgery was so groundbreaking, we first need to appreciate the incredible complexity of what the surgeons were attempting to reconstruct. The male genitourinary system isn't just about reproduction. It's an intricate network of tissues, blood vessels, nerves, and organs that serve multiple critical functions. The penis contains specialized erectile tissue, a complex network of blood vessels, thousands of nerve endings for sensation, and the urethra for urination. The scrotum houses temperature regulation systems for reproductive health. All of these structures need to work together seamlessly. Combat-related genital injuries present unique challenges. Blast injuries from IEDs don't just damage one structure, they often destroy multiple interconnected systems simultaneously. Traditional reconstructive techniques, while valuable, have significant limitations in restoring full function. Conventional reconstructive surgery using the patient's own tissue can restore some function, but often can't replicate the complex sensory and erectile capabilities of the original anatomy. Tissue expanders, skin grafts, and prosthetics help, but they're not complete solutions. Organ transplantation has revolutionized medicine over the past 70 years, but genitourinary transplants represent some of the most challenging procedures in the field. The first successful penile transplant was performed in South Africa in 2014, proving the concept was possible. The challenges are immense. Unlike kidney or heart transplants, genital transplants involve composite tissues: skin, muscle, blood vessels, nerves, and specialized erectile tissue. Each tissue type has different immunological properties and healing requirements. The surgical precision required is extraordinary. Surgeons must connect blood vessels as small as 1.2 millimeters in diameter, reconnect thousands of nerve fibers, and ensure that multiple tissue types integrate successfully with the recipient's body. Beyond the technical challenges, these injuries profoundly impact psychological well-being, intimate relationships, and sense of identity. Veterans often struggle with depression, PTSD, and social isolation related to their injuries. Successful reconstruction can be life-changing in ways that extend far beyond physical function. The Johns Hopkins team spent years preparing for this procedure. They studied previous cases, developed new surgical techniques, practiced on cadaveric models, and assembled a multidisciplinary team of specialists. The ethical considerations were complex. The team had to balance the potential benefits against the risks of lifelong immunosuppression, the possibility of transplant rejection, and the psychological impact if the surgery failed. On March 26, 2018, the Johns Hopkins surgical team began what would become one of the most complex reconstructive surgeries ever performed in the United States. The procedure required unprecedented coordination, surgical skill, and medical innovation. The operation involved a team of over 50 medical professionals including plastic surgeons, urologists, microsurgeons, anesthesiologists, nurses, and support staff. Dr. W.P. Andrew Lee led the surgical team, bringing decades of experience in complex reconstructive surgery. The procedure began with the careful procurement of donor tissue. The donor was a young man whose family made the generous decision to donate organs and tissues to help others. The procurement had to be done with extraordinary precision to preserve all the delicate structures that would be transplanted. Meanwhile, the recipient was being prepared in a separate operating room. The surgical team had to carefully prepare the recipient site, identifying and preparing blood vessels, nerves, and other structures that would need to be connected to the donor tissue. The transplant itself required microsurgical techniques that pushed the limits of human precision. Using high-powered microscopes, surgeons connected blood vessels smaller than pencil leads, each connection critical for the transplant's survival. The procedure involved transplanting not just the penis but also the scrotum and part of the abdominal wall. This comprehensive approach was necessary because blast injuries often damage large areas of tissue, requiring extensive reconstruction. One of the most critical aspects was reconnecting the sensory and motor nerves. The surgeons had to identify corresponding nerve bundles in both the donor tissue and the recipient, then carefully align and suture them together. This nerve reconnection is essential for sensation and function. Restoring blood circulation was equally critical. The surgical team had to connect multiple arteries and veins to ensure adequate blood flow to keep the transplanted tissue alive. Even small errors in these connections could lead to tissue death. Throughout the 14-hour procedure, the team constantly monitored blood flow, tissue viability, and the patient's overall condition. Advanced imaging techniques allowed them to verify that connections were working properly in real time. Importantly, the surgical team made the ethical decision to transplant the scrotum without the testes. This prevented any possibility of the recipient fathering children with the donor's genetic material, avoiding complex ethical questions about genetic parentage and consent. The surgery concluded with careful closure and the beginning of intensive post-operative monitoring. The first 72 hours would be critical for determining whether the transplant would survive and begin the healing process. Within hours, there were encouraging signs. Blood flow appeared adequate, tissue color remained healthy, and initial healing responses were positive. The most complex phase of the journey was complete, but the real test would come in the weeks and months ahead. The surgery was just the beginning of a long journey toward recovery and rehabilitation. What happened in the months following the transplant would determine whether this medical marvel would truly change the patient's life. Like all transplant recipients, the veteran had to begin lifelong immunosuppressive therapy to prevent his immune system from rejecting the transplanted tissue. This requires a careful balance, enough suppression to prevent rejection, but not so much that it compromises his ability to fight infections. The initial healing phase was critical. The transplanted tissue had to integrate with the recipient's body, blood vessels had to establish robust circulation, and the immune system had to accept the new tissue as part of the body. Nerve regeneration is one of the slowest and most unpredictable aspects of recovery. Peripheral nerves can regenerate, but the process is slow, typically about 1 millimeter per day. Full sensory recovery, if it occurs, can take months or even years. The Johns Hopkins team reported encouraging progress in the months following surgery. The patient regained urinary function relatively quickly, which was crucial for basic quality of life and eliminating the need for external urinary appliances. Psychological recovery was equally important. The patient worked with counselors and therapists to process not just the trauma of his original injuries but also the complex emotions surrounding his transformation and recovery. Sexual function recovery is more complex and gradual. The team reported that the patient eventually regained the ability to have sexual intercourse, marking a major milestone in his recovery and quality of life. Long-term follow-up is essential for transplant recipients. Regular monitoring for signs of rejection, complications from immunosuppression, and functional assessments help ensure the best possible outcomes. While specific details about the patient remain confidential for privacy reasons, the medical team reported significant improvements in quality of life, psychological well-being, and overall satisfaction with the outcome. This case joined a small but growing number of successful penile transplants worldwide. Each case has contributed valuable knowledge about surgical techniques, recovery processes, and long-term outcomes. The success of this procedure has led to refinements in surgical protocols, better patient selection criteria, and improved post-operative care strategies for future cases. Perhaps most importantly, the surgery restored not just physical function, but dignity, hope, and the possibility of normal intimate relationships. For a young veteran whose injuries had stolen these fundamental aspects of human experience, the transplant represented a second chance at life. This groundbreaking surgery represents more than just one successful case. It's part of a broader revolution in military medicine and trauma care that's changing how we approach catastrophic injuries. Modern military conflicts have created a new category of survivors, young men and women who live through injuries that would have been fatal in previous wars, but who face lifelong challenges that require innovative medical solutions. Military medical centers like Walter Reed have become leaders in developing advanced reconstructive techniques, often pushing the boundaries of what's medically possible to help wounded warriors reclaim their lives. The collaboration between military medicine and civilian medical centers like Johns Hopkins represents a powerful model for advancing medical care. Military medical challenges often drive innovations that benefit all patients. The techniques developed for this surgery have applications far beyond military medicine. Civilians with traumatic injuries, cancer patients requiring reconstruction, and people with congenital abnormalities can all potentially benefit from these advances. The success of this procedure has led to expanded training programs for reconstructive surgeons, development of new surgical curricula, and improved simulation models for practicing these complex procedures. Military medicine has also advanced our understanding of the psychological aspects of traumatic injury and recovery. The integration of mental health support with surgical care has become a model for comprehensive patient care. Military funding for medical research has driven innovations in surgical instruments, imaging technologies, and biomaterials that benefit all of medicine. The demands of military medicine often push technology development faster than civilian applications alone. Military medical challenges are universal, leading to international collaboration in developing new treatments and sharing best practices across different healthcare systems. Looking ahead, military medicine is exploring even more advanced approaches, including regenerative medicine, tissue engineering, and bioprinting technologies that could further revolutionize trauma care. These advanced procedures are being integrated into broader military medical protocols, from battlefield care through long-term rehabilitation, creating comprehensive systems of care for wounded service members. While complex procedures like penile transplantation are expensive, the long-term benefits in terms of reduced healthcare costs, improved quality of life, and restored productivity make them valuable investments in veteran care. The success of this procedure has implications that extend far beyond military medicine, potentially transforming how we approach reconstructive surgery and transplant medicine worldwide. Composite tissue allotransplantation, the transplantation of multiple tissue types together, represents one of the newest frontiers in transplant medicine. Face transplants, hand transplants, and now genital transplants are expanding what's possible in reconstructive surgery. Advances in immunosuppressive protocols, driven partly by cases like this, are making transplants safer and more successful. New drugs and treatment strategies are reducing the risks associated with lifelong immunosuppression. The ultimate goal is to move beyond transplantation toward regenerative approaches, growing replacement tissues from the patient's own cells, eliminating the need for donors and immunosuppression. Emerging technologies like 3D bioprinting and tissue engineering could eventually allow us to create replacement organs and tissues on demand, customized for each patient's specific needs. These advances are also driving the development of new ethical frameworks for transplant medicine, particularly around consent, quality of life considerations, and resource allocation. The growing community of composite tissue transplant recipients is creating new support networks and advocacy groups, helping future patients navigate the complex journey of transplant surgery and recovery. As these procedures become more established, questions arise about global access, medical tourism, and ensuring that advanced treatments remain available to those who need them most. Healthcare systems worldwide are grappling with how to integrate these complex, expensive procedures into existing care networks, while ensuring appropriate patient selection and support. Medical schools and surgical training programs are beginning to incorporate composite tissue transplantation into their curricula, preparing the next generation of surgeons for this expanding field. Government and private funding for transplant research continues to grow, driven by success stories like this Johns Hopkins case and the potential for helping many more patients. With great medical advances come complex ethical questions, and genital transplantation raises some of the most challenging ethical issues in modern medicine. The informed consent process for these procedures is extraordinarily complex. Patients must understand not just the surgical risks, but the lifelong implications of immunosuppression, the possibility of transplant failure, and the psychological impact of the procedure. How do we measure success in procedures like this? Traditional medical outcomes like survival and function are important, but quality of life, psychological well-being, and patient satisfaction are equally crucial. These procedures are expensive and resource-intensive, raising questions about healthcare equity and resource allocation. How do we ensure fair access while being responsible stewards of healthcare resources? Patient privacy and dignity are paramount in these cases. The medical community has had to develop new protocols for protecting patient confidentiality, while still advancing medical knowledge through case studies. The impact on families and intimate relationships is profound. Comprehensive care includes counseling and support for partners and family members who are also affected by the injury and recovery process. These procedures require lifelong medical commitment from both patients and healthcare systems. The ethical obligation to provide ongoing care extends far beyond the initial surgery. The 2018 penile transplant at Johns Hopkins represents more than just a surgical success. It's a testament to human ingenuity, medical dedication, and the power of hope in the face of devastating injury. This groundbreaking surgery demonstrated that complex genital reconstruction is possible, that function can be restored, and that quality of life can be dramatically improved even after catastrophic injury. The techniques, knowledge, and experience gained from this case have already influenced surgical protocols, training programs, and patient care approaches around the world. Research continues into better surgical techniques, improved immunosuppression protocols, and ultimately, regenerative approaches that could eliminate the need for donor tissue altogether. For wounded veterans and civilian trauma survivors facing similar challenges, this surgery represents hope, proof that even the most devastating injuries don't have to mean the end of a full, dignified life. It also highlights the extraordinary dedication of medical professionals who refuse to accept impossible as an answer, and who continue pushing the boundaries of what medicine can achieve. If stories of medical innovation and human resilience inspire you as much as they inspire me, make sure to subscribe to Mind and Marvel and hit that notification bell. We're living in an incredible time for medical breakthroughs that are changing lives every day. I want to hear your thoughts in the comments. What aspect of this medical breakthrough impressed you most? How do you think these advances will change the future of reconstructive medicine? What questions do you have about transplant medicine and patient care? Most importantly, this story reminds us of the sacrifice made by our military service members and the incredible resilience of the human spirit. Medical advances like this give us hope that no injury is beyond the reach of human compassion and ingenuity. Thanks for joining me on this exploration of medical innovation and human resilience. Until next time, keep marveling at the incredible advances that are changing lives and restoring hope.